At structures on the sternum and the ribs. We will start with the sternum. This sternum happens to be broken, but normally this would be one whole piece. It has three parts. The part that is a little bit larger is the manubrium. And then we have the body. And the most inferior portion of the sternum is the xiphoid process. If you ever had the wind knocked out of you, this is right there. This is also the location, I believe, one of the landmarks you're supposed to find to do CPR. The ribs are attached to thoracic vertebrae and either attached directly to the sternum, directly to the cartilage of another rib, or are floating. All of the other structures on the rib is the same. We saw on the vertebrae that we have rib articulating facets. When there is a facet on the rib, there is a superior portion and an inferior portion. These are the superior and inferior facets. The costal angle is simply the angled portion of the rib. The costal groove is on the inferior portion of the rib, and when I flip it over, you'll see this little nook or the groove that becomes apparent once you see underneath. This is the costal groove. This would be for sites for muscle attachment, but also locations for nerves and blood vessels to be along the bone. The body is the portion of the bone that does not have a costal groove. And if I move my vertebrae, we can see all these tubercles that are the raised portion that are about an inch away from the posterior portion of the rib. And no matter which one I flip over, the costal groove becomes visible. Some are more apparent than others. Usually the larger ribs show it a little bit easier.